cannot do to people. So allow me to do it on behalf.
Gavumenti ya America eddukiridde gavumenti ya Uganda n'ebyuma ebiyamba ku baana abazaliddwa nga tebannatuuka okusobozesa abaana bano nabo okukula obulungi. Omubaka wa America mu Uganda William Pope yakwasiza gavumenti ya Uganda ebyuma bino ng'ayitira mu tterekero lya gavumenti ery'eddagala lya Joint Medical Stores. Omubaka Pope agamba nti gavumenti ya America efaayo nnyo ku bulamu bw'abantu mu nsi yonna naddala owa bannayuganda naddala era abaana abazaalibwa nga tebannatuuka kibasobozese nabo okweyagalira mu nsi eno.
PEPFAR, our primary HIV program, the United States President's Malaria Initiative, and other health initiatives of the United States. But today, I'm very excited to be part of this flagging off of maternal and child health equipment that we are donating the United States government through the United States Agency for International Development. And I want to begin by recognizing Dr. Daniel Chabatini from the Director of Public Health for the Ministry of Health, recognizing his presence as the representative of the ministry and on behalf of the minister, all the officials of the Ugandan government that are.
Popo agamba newankubadde Uganda ekoze kyamaanyi nnyo okukendeeza ku muwendo gw'abaana abafa. Popo agamba newankubadde Uganda ekoze nnyo okukendeeza ku muwendo gw'abaana abazaalibwa nga tebannatuuka abafa, naye amaanyi gakyetaagisa wano na wali.
Here in Uganda to further reduce these deaths. Over the every year, as many as 25,000 mothers and 1,000 babies are victims of mortality due to various medical issues here in Uganda. And we know that through providing good equipment, quality equipment, through providing training, capacity building, that integration of equipment and supplies together with the human capital investment can help save lives. And so today is a great day for our partnership and working together to reduce maternal and infant mortality. The equipment that we are donating is not only going to benefit these 36 hospitals, but also we estimate save more than 280,000 lives every year and help support mothers and babies being born in Uganda and help start lives off on a strong footing. And so this is equipment that you can see is everything from neonatal equipment that is helping premature babies to normal births, incubator units, birthing equipment, ventilators, oxygenators.
Gavumenti ya Uganda egamba ebyuma bino byakuyamba nnyo okukendeeza ku muwendo guno era n'esuubiza okuwa embalirira kw'ebyuma bino yonna gye binaaba bitwaliddwa.
Most recent statistics for our country are encouraging to see that after all these years of investments, we're starting to see the change. We need to be able to share what we mean when we see these indicators improve. Ugandans are now living up to almost 70 years life expectancy. That does not just happen, but somebody's investing in the health system. The maternal mortality we've talked about, the indicators are improving to almost now 187 per 1,000 delivery of live births given. We are seeing the neonatal mortality coming down, not so significantly, but now with the equipment of sustaining the first lives, the oxygen concentrators, the key equipment that is needed, is a very good welcome.
Kigambibwa nti wano mu Uganda abaana abasoba mu mitwalo 2 be bazaalibwa nga tebannatuuka, ng'ate abaana abasoba mu mitwalo 12 abali wansi w'emyaka 5 be bafa nga n'ensonga ezisinga okubatta ziba zeekuusa ku buzibu bwe baba baafuna